financial literacy, and the human condition. Welcome to Financial Fitness with the Money Doctor, Dr. Francis Rayam.
Hi, it's Francis. I just wanted to take a minute to thank you for watching this video. If you're catching us on YouTube, please help us help others by clicking like, subscribe, and all notifications so you don't miss any videos. And check back for the next video. I think you're going to love it. Thanks again. For more information, you can visit us at hugyourmoney.com.
Welcome to Financial Fitness. I'm Jess Tyler, along with the Money Doctor, Dr. Francis Rayam. Hi.
Hi, Jess. How are you?
I'm really good. We have a guest today.
We do. I love it when we have guests, especially when they're, they really have something important to say. And so I'd like to welcome to Financial Fitness, Justin Nabity. And welcome, Justin.
Thank you. It's good to be here with you, Francis and Jess.
Thanks. So Justin works specifically, and not only, but specifically with what many people would call heavy hitters. We're talking about physicians. We're talking about institutions like Yale and Harvard. And okay, so he's got something to say here. And I wanted him to come on the show in part because we share a lot of commonality in the way we run our businesses, and the idea that we talk about the psychology of money and the reason people make decisions, not just about the numbers. And he helps people align their finances with their financial goals, with their life goals. So, I just want to say that he is a certified financial planner, but I will ask you if you don't mind starting with your story about, can I give away your age? Well, I'm going to, folks. I'm going to give away his age.
You just did, yeah.
I just want to say that at age 39, Justin was faced with a decision. It's all yours, Justin.
So 16 plus years ago, almost 20 years ago, it was married into a family of doctors. And my wife's father's a doctor, both of her brothers, her brother's wife, her aunt and uncle, her cousin's husband, father, and grandfather. And as I was going through undergrad, a lot of my friends and fraternity brothers went through the medical school residency and fellowship process. And I come from I'm the third generation in financial services, with my grandfather and father both being in the industry. And so here we are looking at a group of people who you would think have it figured out. Certainly they're brilliant, they're bright, they've got an amazing career ahead of them, taking care of people. And along the way, what I find out is that the number one financial concern among physicians is having enough money to retire. How is it possible that this group of people would have that be their number one concern? Makes no sense to me.
Yeah, and I would say that, the general consensus is, oh my gosh, they make so much money. Why can't they, retire? And from my standpoint, I would say, first of all, their student loans are a fortune, $200,000, $300,000, $400,000 in student loans, right? And secondly, malpractice insurance, right? How the insurance companies pay slowly and pay less than you might think they're paying. The overhead is astronomical. But above all of that, where in medical school do you learn about managing your finances?
You don't. They actually don't. This isn't funny. I've had conversations with program directors, the doctors who are in charge of teaching the next generation. They'll tell us that it's not their job to teach doctors anything outside of the patient room. Most jobs don't necessarily come with a 10 to a 30-page employment contract, but doctors do, pretty much every single one. It's rarely do you find that a doctor does not have a large document drafted by an attorney. And these attorneys are working for the employer, and they're looking out for their best interest. And so they want to make sure they capture everything they can in the event that a doctor leaves. Well, what's the turnover rate like for young physicians? What's the likelihood of a physician continuing on with their first job? It's very low. And when they leave the job, there's usually clawbacks. There's signing bonuses that need to get repaid. There's income plans that are called income guarantees, which, it says the word guarantee. Like, isn't that good? Isn't that like safe? Income guarantee means you're getting advanced money, and you can keep this money if you produce enough.
Right.
If you don't produce enough, they're going to take it back.
In the rest of the world, Justin, we call that a draw.
It's a draw.
It's a draw.
It's a draw.
you talk about a ripple effect or a trickle down thing. If you're going to the doctor and you've either had, oh, I don't know, three primary care physicians in the last 2 years, okay, or you're saying, I want this treatment, and they're saying, but insurance won't cover it. You need to be paying attention to this stuff because if
Right.
we don't solve this problem at the top, right, we aren't going to solve it at the bottom. Yeah.
What you just said, the ripple effect, that word, it triggered me. And you think about trigger words. You literally gave me full body chills when you said that. Why? I'm not
Sorry.
kidding.
Yeah,
That's
well,
why. That's why if you saw me, if you replay the video here, you'll see I went like this.
yeah.
You can't. I'm wearing sleeves right now, so I can't show you my goosebumps. But
Oh, yeah.
the ripple effect, in when I got into the industry, it was like, okay, I want to do something that I actually care about, that I am deeply passionate about, and
Right.
I saw an opportunity where the community could flourish if doctors were in tip-top shape, patients would get good quality care, and I didn't even know how bad healthcare was back then. I really
Mm,
didn't. I thought here's a vulnerable group of people that need help because they don't know what they're doing outside of seeing patients. But the issue that they are are dealing with is if you give bad patient care, then the patient's not going to do well. So your community's going to suffer. So if we take care of the patient or they take care of the doctors in a way that they're at their best, then patients will get better care and then that'll have an effect. So that it took me all the way back to the beginning of the very early stage, like this is it. This is where I want to go deep to make this happen. Do you know that 2/3 or more of doctors are on antidepressants and on
oh my
anxiety
gosh.
medications?
Yeah.
2/3. And actually, if you search the suicide rates among doctors, it's double the general population. Double. And in the last 40 years, what's happened is healthcare has gone from being controlled by physicians to now being controlled by insurance companies.
That's right.
And
Yep.
and is an insurance company going through medical school? No. Are they ever getting trained by a physician on how to take care of patients? No. So that has a ripple effect on what we receive. When we want to get a procedure done, the doctor has to get permission from the boss. Well,
Yeah.
who's the boss? It's the insurance company. Like the doctor knows what's best for us. They're the specialist, and yet they can't even decide. They get shut down. So it's a
Yeah.
huge factor to why our cost of healthcare is rising.
I certainly agree with you on that. And also I'm sort of a big picture, when I went right to this ripple effect thing, I'm sort of a big picture kind of person, I think in terms of larger pictures. When you've been in your career for
Hmm.
10, 20, 30 years, you don't really want to say, hey, I don't like that the insurance company is now making my decisions. I better go back to college and learn how to be something other than a physician, a vet, a dentist, right? A medical professional. People signed up for one thing
They
quite some
did.
time ago
They
under the
did.
guise that they were going to have this nice lifestyle, that they would be well respected, that they would be
Right.
doing something good in the community, and that they
Hmm.
could make a difference. And now, if you know any, and I have several friends who are physicians, right? If you know any, and you have a frank conversation with them when you're not their patient, they will tell you it's a nightmare. I get 7 minutes with a patient.
It's
If
terrible.
I go over 7 minutes or 15 minutes or whatever, then you probably know the number. But if I go over that, I can't fit the insurance billing in. This is not what healthcare is designed to be. And it may not sound like it's connected to the general public, but we're talking about people providing not just general office healthcare. These people are doing surgery, okay?
Yeah.
Life or death situations
Right.
on our pets, all of that, right?
Yep.
And we're not giving them any support in terms of finance. So I don't know why this isn't taught. So let me ask you that, Justin. When you're speaking at Yale or Harvard or the Mayo Clinic or the Cleveland Clinic, or you have a
Yep.
very impressive list of places you've spoken to in person or spoken at in person
Hmm.
on website, which can I just say, is it, do they go to physiciansthrive.com?
Physician, yeah, it's Physicians Thrive. Yeah, that's where it all started.
Yeah, physicians plural, physiciansthrive.com.
Yep.
So if
Yep.
you go there, you can read about Justin Nabity. But um, when you go there and you say to them, how come you're not teaching this? And they say, it's not our responsibility.
That's
Then
what they
what,
say.
then what happens? Do you say, well, we've got a program we can bring? Or what happens from that point
Well,
where they say, sorry, not our job,
yeah, I share that example because that's where places really just kind of stick their head in the sand. There are others that will allow avenues for it, whether it's during work hours, which is usually already built out. They have their entire pipeline for the semester.
Yep.
Sometimes they'll do after hour sessions, they'll do retreats. They do have doctors come in and speak. It's really interesting. They'll even have alumni come and give talks that I started teaching back in the day. It's like they're communicating their story from a physician's perspective, but it's pretty narrow. What you said at the beginning, we haven't touched on it yet, is they come out with an average debt of around $220,000.
Mm.
Can you imagine? You finish.
I can, yes.
I mean, I know you can because you're the pro at this, but you got 4 years undergrad and 4 years medical school, 8 years, and what do you have to show for it financially?
Yeah.
You have, we call it in the imaginary McMansion. It's this mortgage that you have now. Now, it has a lot of value because you have the human capital associated with it, and you can create the income ongoing. But you have this debt boulder
Yeah.
that you're carrying.
Yep.
And so anybody who has debt, it's to what you said, it affects you in a significant way. And we have a client who's a headache specialist, neurologist, and he teaches at businesses in the workplace about like employee wellness in the workplace, absenteeism and presenteeism.
Yeah, we just talked about this on a show too, absenteeism and presenteeism.
It's a real expensive thing,
It
and
is.
migraine, and it's this mysterious, debilitating disease, like actually headache, and it's like the number one, number two cause of disability is issues with your brain that you're having.
Sure. I'm having an issue with my brain right now. And we need to take a break for a minute. So I just want to ask you if you'll stay with us for the second half, Justin.
Sure thing.
Thanks.
All right. In the meantime, can we get your phone number?
402-515-6327.
And Francis?
413-773-3333.
And you can also go to hugyourmoney.com. We'll be back with more part 2 coming up of Financial Fitness with the Money Doctor, Dr. Francis Ram on WHMP.
Financial Fitness with the Money Doctor is underwritten by Franklin County Technical School. We build futures. Visit fcts.us or call 413-863-9561.
And we are back. Welcome back to Financial Fitness. I'm Jess Tyler along with the Money Doctor, Dr. Francis Ram, and we have a special guest today, which is always fantastic.
We do. Justin Nabity is with us, and a CFP, a certified financial planner, for those of you who don't love the alphabet soup of the financial world. And, I started the show by saying he has a special niche with physicians, but the idea here is that it is important to all of us. First of all, you may be a physician listening to this, or you may learn something from the show, but it's important to all of us to free these people who are in charge of our health care from the financial stress they have.
Mm-hmm.
And I'm not saying we'll just pay off their student loans for them. That's a totally different show. But they're stressed about finance because they're not taught anything about it.
Mm-hmm.
And it's just like the rest of us, by the way. If you thought this was an elite sect that somehow had a handle on their money because they're brilliant physicians, and think again. These people are brilliant, but they have the same problems we have at a lower level for money. So I wanted to ask Justin specifically to talk a little bit about, at this very basic level that affects us all,
Mm-hmm.
what the heck is going on with healthcare costs? Why do healthcare costs keep rising, involving insurance? Anything you can teach us about that, please?
Yeah, I wish we could just say it's one thing and then just go after that one thing and then it'd be problem solved.
Sure.
But one of the biggest issues is the administrative burden, which you've alluded to a little bit earlier with the coding and all the different hoops you have to jump through to practice medicine. But if you had to guess how many administrators there are for every one doctor in practice today, how many would you say?
Wild guess, 9.
It's 10. So you're
Oh,
spot
I
on.
was close.
Yeah, you're so close. That was awesome. Yeah, 10.
Thanks.
10.
Wow.
So why wouldn't it be that there would be like 1 or 2 administrators for 5 or 6?
Right.
Or like, why couldn't they come up with a way to run the business side efficiently from a regulation perspective to be able to support multiple people? if you work in any industry, let's say you have a sales team, you usually have a sales manager. That one person is responsible for serving and supporting a number of people on the team.
Well,
It's
it
the
was
exact,
that way. It
what's that?
when we talk about how things have devolved, right?
Yeah,
Not evolved,
yeah.
it was that way. Somebody in my family used to work for an eye doctor's office, and there were 5 doctors in that office, and there were 3 people up front, and they handled everything,
Yep.
So, and that was not very long ago. So what's
When,
happening?
when you can look at there's charts that show the growth in the population of physicians over time, and it's very flat. And then you look at the growth in administrative personnel, it's actually like very alarming when you look at it. They haven't done a new study of this, and I don't know if somebody's just like preventing the data from coming out because they don't want to show how bad it is. Because I think the last time they showed it was like 2010. Like they showed like uh, 2000 to 2009 or 10, and then it stopped.
Mm.
And they haven't produced the latest. But that's a factor. You've got technology and all the advances there. You got drug costs and what they're charging here in the US versus other places around the world. That's a major factor. We have people that are more chronic illness is a factor. Going back to
The
doctors not getting
population.
education
Yep.
for finance or financial literacy, guess how many hours of education there is on nutrition for medical school?
I bet not many. Am I
It's like
wrong?
it's like maybe 8
Yeah.
hours in
I mean, that's
4
crazy.
years.
On nutrition. Yeah.
And
Oh, go ahead, please.
I mean, what's the most important thing when it comes to your health? You can't change your genes. You can't change who your parents are, but you can change what you consume and what your lifestyle is.
Sure.
Why aren't those two things like at the top
Do you
of
happen
the?
to know how many hours are spent on prescription medication?
I don't actually,
I bet it's a
but
lot, probably, right?
well, I mean, the majority of the way that it's the whole thing is it's all about sick care. It's not true healthcare anymore. There's health insurance is not healthcare.
Well, health
It's
insurance doesn't pay much for preventative medicine,
no.
right? You brought up the administration thing, and I think when I talk to colleges and universities, they're suffering from a very similar thing, and so there's some overlap here. If you look at the amount of administration at a
Mm.
college or a university today compared to what it used to be, the
Mhm.
administrative jobs are plentiful now and needing to be filled. So there's all these layers. All of this costs money,
Mhm.
right? I mean, when you talk about why is the cost of something so high, we got 10 people. What was it? 10 administrators for every one physician?
It's the exact opposite of what it should be.
Yeah, they all get paid. And the same thing at the colleges, a lot of administrative personnel. Not that I don't want people to have jobs, but all of this stuff has to get paid. And so that is going to come from someplace. And, people will say, well, let the government pick it up. Well, where does the government get their money? The taxes. Who pays taxes?
Yeah.
Us.
Well, you're
Okay,
you're you're
so,
pressing on a nerve right now for me that really,
oh, good.
like, I mean, there's 4 ways to spend money. And Milton Friedman, one of my favorite economists, talks about this. You can spend your own money,
Yeah,
or you can spend other people's money
yeah,
on yourself. Well, you can spend your money on yourself, you can spend your money on other people, you can spend other people's on yourself, or you can spend other people's money on other people.
right.
And the system is so complex now, and it's almost like intentionally designed to be this way to make it difficult to address the problem. And you've got all these people now deciding how money should be managed, and it's not for your best interest. Some of the other things that are factors with the cost of healthcare going up is fee-for-service models. They're trying to get doctors to do every single test. Like my father-in-law, he just retired at 45 years of emergency medicine, and he had run-ins with management where they were telling him, you need to order this test and that test, like all these things that you need to do for the patient. He's like, well, they didn't have indications for that. Like, I'm not going to go order all this stuff. That's why you get like 5, 6, or 7 bills sometimes when you go in, because you have different groups charging for different things. He got into not necessarily fights with them, but like they were pressuring him and they were threatening him that he needs to do these things. He's like, well, I'm supposed to do no harm and do what's in the best interest of my patient and look out for them. And the pressure is see as many patients as you possibly can, run them through, bill as many codes as you can, order as many tests as you can, even if it's not relevant. And I think it's what's hard for us as patients is we think the doctor is the problem, or the doctor tends to get pinpointed as the issue, when in reality, it's everything else behind them. There's so many competing forces that are driving the attention, and they don't even get to decide. So part of this is having that understanding that you're, in a way, it's almost as if doctors don't exist anymore, really, because of what we talked about before with the insurance companies taking over.
You know, Justin runs a podcast called Doc Nation, DOC Nation, right?
Yeah, that's right.
And I just wonder, you know, we try to do these shows where we sort of shine a light on a problem, and then we also try to say, you know, this is what could be done about it, right? So that people have some action points. So I will ask you, because Doc Nation, I believe, is a place where physicians can go and be in a meeting and discuss this kind of thing. Am I right about
You
that?
can. Yeah. And actually, I'm glad you bring it up because for you, the patient, this is you and me and every single one of us. All of us are a patient. Healthcare is in a terrible place. Why is it that in 2025, after all the investment, after all of the research, after all the technology, after all the things, we're in terrible health condition compared to how it used to be as a nation? So bad. And it's because doctors don't get time with you. They need more time with you, the patient. And they don't get that because of what's happened within healthcare with the corporatizing of medicine. And so I say that because there's a bill in DC right now called HR 10073.
Yep.
And why is this bill important? And why is one of our members of Doc Nation testifying and speaking and communicating with at congressional hearings about this? It's because for 24 years, Medicare has been cut for doctors, but it hasn't been cut for nurses. It hasn't been cut for physician assistants. It hasn't been cut for hospitals and the facility fees. But for physicians, the ones who we talked about before, 8 years of their life have sacrificed just to get the education piece. Then they go on for 3 to 7 more years of residency, and then 1 to maybe 5 or 6 more years of fellowship. Like it could be 20 years that they're in this pipeline to help you take care of yourself. They're the only ones within the healthcare sector that's getting cuts.
I didn't know that. That's very interesting.
So why would, if the patient needs better care and the one who knows and can actually bring the care the best doesn't get time with you because cuts for 24 years, doctors are negative over 24 years on pay. They're negative. They haven't kept up with inflation. So
no one will believe that, Justin. Believe it or not.
Look it up.
Nobody listening to this will
I know,
but it's true, right?
I know, but it's true. From where it used to be 24 years ago, it is down.
Yeah.
And malpractice is a major issue. And every doctor, I mean, it's going to come at some point. But HR 10073.
I have to ask you a question about that.
Yeah.
We only have a couple of minutes left.
Okay.
But, so first of all, what can people do? They can look up HR 1007.
Ask the congressman of your district to co-sponsor. There's over 70 co-sponsors. When we first got onto this, there was like 50. And so we've gotten a bunch more co-sponsors. There's over 213 congressmen that signed a letter supporting this. And this is all the way to the right, all the way to the left, and everybody in between. This is like across the board, it's bipartisan. So the people that you don't like and the people that you do like, everybody you'll find it's gaining the attention of this is the most support we've seen. So this is to stop the cuts and even do some reversal to empower your person who's supposed to take care of you to be able to have more time with you. And if this goes through, this will be the first time in a couple of decades where we've seen something that could be fruitful to help you get better care.
I I thank you for that. And we will put the information up so that people can go and find out about that and decide what they want to do. But I just want to ask you one more thing. From a patient standpoint, I go to the doctor, I want to see a doctor, and somebody says, no, you need to see this nurse practitioner. The doctor's busy. You need to see, somebody else. Is that, in your opinion, is that because Medicare will cover that full amount and the money is there and it's been cut back from the doctor side of it? I mean, that's really a layman's question, but I'm a layman when it comes to being a patient. So,
well, there's two sides of business, right? I mean, you want to try to minimize costs and you want to increase the amount of revenue coming in, just simple math.
yep.
And the cost for NPs and PAs to the healthcare establishment is less. So they're going to prefer that all day long. You do have the factor that comes into play, which is the physician shortage. We don't have enough doctors as it is. There aren't enough residency spots open. Huh?
I wonder why. Gee, it sounds so appealing after listening to this. Yeah.
Well, if you're really smart and you care about finance and like getting good return on investment, it used to be that parents and grandparents would tell their kids to go into the same profession that they did.
Right.
Back in the day, your family had a trade or had an occupation. You kind of did that.
Right.
Now they're telling their kids, don't do it.
Yeah. Yeah.
And you have really high quality people that have good families that it'd be great to have the next generation be coming in and taking over, but they're telling them not to.
Yeah.
So
this is just one more sign of this. We need to do something about financial wellness for everybody. And the fact that the doctors are under so much stress, that they have so much administration, all of that points to the same thing. We've got to get tools to people to be able to manage their finances well and actually probably try and reverse this situation where the insurance companies are making the decisions about our health care. Justin, closing argument from Justin.
Yeah, Jess, to your point, I hear you. I thought the same thing. And I've been nothing but entrenched into the world of their personal lives based on the business. And if you look at the entire money spent in healthcare today, the trillions of dollars, guess what percentage of that share of the pie do doctors receive of all of the healthcare dollars? What percent you think?
20.
That's what I would think. That would be reasonable to me. 7 to 8% is all they receive.
Wow. Yeah.
Yeah.
Well, I'm sure people will have questions, so let's get information from both of you. Justin, where can people reach out to you?
So you can email me or contact us through our website, physiciansthrive.com. Email justin.nabity@physiciansthrive.com. And you can also reach me 402-515-6327.
Excellent. And Frances, your phone number?
I just want to thank Justin for coming on the show. And my phone number, of course, is 413-773-3333.
And you can also go to hugyourmoney.com. We'll be back next week with another edition of Financial Fitness with the Money Doctor, Dr. Frances Ram, on WHMP.
Financial Fitness with the Money Doctor is underwritten by Hug Your Money. So unique, it's patented. Financial coaching and more information at hugyourmoney.com.